Medical Notepad, brought to you by Cardiovascular Systems Incorporated's Patient Advocacy Campaign, Take a Stand Against Amputation, and The Way to My Heart.
My name is Anahita Dua. I am a vascular surgeon at Massachusetts General Hospital and Harvard Medical School, an associate professor of surgery. And this is this week's Medical Notepad.
Why should patients really take into consideration, yes, you should stop smoking anyway, but why should they really take it into consideration before any procedure?
Great question. I'm so glad you asked that. So I'll start out by saying, I know that, you go to any doctor's office and the doctor would be smoking a cigarette themselves back in the day and tell you to stop smoking. So it's become sort of doctors just want me to eat healthy and stop smoking. It's true, but let me tell you why specifically, scientifically, it matters in PAD. So basically, in peripheral artery disease, okay, the artery has 3 layers. Think of a layered cake. The inner layer of the artery is like an ice skating rink, okay? That's called the intima. It's flat. Why? Because blood shoots past it. So imagine someone shooting on that ice skating. The next layer is a muscle. And the final layer on the outside is like a garbage bin liner. It's like a stretchy, strong thing that holds everything together. Now, smoking specifically, we don't know what chemical or what it is, but smoking specifically has something within it that causes cracks on the ice inside the blood vessel. So think of a bagel that we put cream cheese on. What happens if you put cream cheese on a bagel? It's nice and smooth and silky. But if you leave that bagel out overnight and you come and take a look at it, when the cream cheese dries, you get those cracks, right, in cream cheese? That sort of crack is exactly what happens inside the blood vessel. Now, as I said earlier, blood is pretty stupid. It either clots or it flows. So imagine if you're skating on ice and there's a giant crack. What's going to happen? You're going to fall because your ice skate is going to get stuck and you're going to fall. Similarly, blood is made up of a bunch of cells, okay? Those cells, when they skate over a crack, fall into that little divot. And when blood is stressed or is suddenly not going in a straight line, it triggers the clotting cascade. So when the blood slips into those little cracks in your now cracked inside of the blood vessel, you will start to form clot in those little cracks. And clot makes more clot because the blood's going to say, hey, they're clotting over there. Whoa, we need to all be clotting. And the whole blood vessel now with all those cracks form these columns of clot that then stop all blood flow from flowing. So if you smoke, it causes the inner lining of your blood vessels to thrombose. And that is why doctors don't like to operate on someone who's smoking, because we know that you already are in a state where you're likely to clot because you're already hypercoagulable because we've just operated on you. So your inflammatory markers are on off and all these things are happening. Now you're going to add to that the cracks. Oh my goodness, that is going to clot. And so we know that, and that is why doctors can be so aggressive about, no, I will not operate on you if you're smoking.
I also had learned it also makes your blood just sticky.
It sure does. It makes you what we call viscous. So think of water. That's what your blood should be like water. But when you smoke, your blood becomes like honey. So a little bit thicker. Now, when it's thicker, it's more likely to clot. That's why pregnant women get blood clots that go to their lungs. That's what's happening. When you're pregnant, you have an increase in pregnancy and, an increase in your blood becoming thicker, and that increase in your blood becoming thicker ultimately results in your clotting occurring. So the same exact thing happens. And so forget blood clots just in your legs. Stroke, heart attack, those are all blood clots.
Remember, the advice and views offered during this series are for informational and educational purposes only. Always ask your own healthcare provider for explicit consent before acting on any information provided here. If you want more information on peripheral artery disease, go to standagainst.amputation.com. And for real-time support, go to thewaytomyheart.org.